Bismillahirrahmanirrahim. Respected members of Pakistan Endocrine Society and distinguished guests and worthy colleagues, Assalamu alaikum, and I welcome you all to the scientific session 7, which is about the prevention of type 2 diabetes, the way forward. You all know that the prevalence of diabetes is increasing. 643 million people around the globe are diabetics, and in Pakistan, there are 33 million people are suffering from diabetes. So what we are doing for the prevention of diabetes? To talk about this, we have two worthy speakers, and who will talk about the regional as well as the global aspects of the prevention of type 2 diabetes. But first, I'll request my chairpersons to come on the stage and take their seats. And I will first invite Dr. A.H. Amir, who is Professor of Diabetes and Endocrine, Hyderabad Medical Complex, Peshawar, Pakistan. He is a recipient of the Advisor Scholarship USA. He has Lifetime Achievement Award of Pakistan Endocrine Society. He is President of Pakistan Acknowledgement Award for Services in Diabetes, immediate and past President, American Association of Clinical Endocrinologists, past President, Pakistan Endocrine Society, and Vice President of South Asian Federation of Endocrine Societies. Sir, kindly take the chair. Thank you so much. Now request Dr. Aisha Sheikh. She is consultant endocrinologist and diabetologist, Agha Khan University Hospital, Karachi, and she is the current president of Pakistan Endocrine Society. Kindly take the seat. Now I request Dr. Arshad Hussain. He is consultant physician in diabetes and endocrinology at Northwest General Hospital and Research Center, Peshawar, and he is a lead for Pakistan Diabetes Prevention Program. Kindly take the seat on the stage. Now I request our first speaker, Dr. Ibrar. He will be talking about the regional Pakistan aspect of the prevention of type 2 diabetes. He is the past president of Pakistan Endocrine Society. He is a consultant diabetologist and endocrinologist, and the head of the division of endocrine of diabetes and metabolism at Lady Reading Hospital, Peshawar. Thank you, sir.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. First of all, I am thankful to scientific chair for drafting this scientific program, because they have touched type 2 diabetes, type 1, SMILE project, which is in front of you, giving insulins, and now prevention. So coming to the prevention aspect, when I was touching the literature or seeing what Pakistan had did, हमने क्या किया, what we have done. So the things are that we are doing so much in the form of seminars, walks, awareness, mobile clinics, some initiatives from government, social media awareness programs, some research. But the question mark is that either we are touching it or not. So for these things, what thing is missing? The missing link is that the coherence, these are these related with us, and we are getting our good numbers or not. So thinking about it, the need of hour is that whenever there is something important, what should we do? Either we are on time, or before time, or after time. But looking at the numbers of diabetes, I think we are a bit late. So the need of hour is the urgent thing. So how to tackle it? The things are that how to tackle the need of hour of diabetes. As we are talking of diabetes, internationally, whenever you get to know about how to tackle the need of hour, first you have to identify the problem. Our problem is identified, then you assess, then you prioritize your funds, your energies, and then allocate them. And the timely decisions. If you are late, you will get this good figure of more than 33 million. and collaboration among ourselves, which we are lacking at every level as an organization, as a government part. And then you improvise, and in the last, you monitor what you are doing. So you all know that the diabetes is on rise everywhere in the world. And in Pakistan, if you look this region, we have increase of 87% in the past IDF, according to IDF at this in the past. So coming to prevention strategies, what we can do for communicable diseases and non-communicable diseases. All over the world, communicable diseases always having vaccination, hygiene, lifestyle improvisation, screening and checkups, safe practices, environmental managements, vector control, and quarantine, etc. We are well aware of it. In the past COVID-19, that for communicable diseases, you have some prevention strategies. For non-communicable, lifestyle modifications, early screening, monitoring and management, limit sedentary lifestyle and mental health improvisation, and adequate sleep. These are for non-communicable diseases. So if you compare non-communicable with communicable, I think the burden of finances of communicable diseases are measurable. You can measure it, but for non-communicable, you can't measure. So this is the main problem where we are lacking behind. If you look at the global prevention strategies of non-communicable diseases, what people are doing internationally, they are promoting healthy lifestyle, healthy eating habits, regular physical activities, stress managements, regular health checkups. Are we doing the same? I think these are the things we are doing, but in individual capacity, not in a coherent way. The steps taken by government by world for prevention of diabetes are some health promotion programs, healthy diet promotions, physical activity encouragements, taxation, screening programs, accessibility care, school programs, collaborations. These are so much things that world is doing for prevention and for prevention of diabetes also. And community-based learning. Is Pakistan doing these? Yes. For that, in Pakistan, in my opinion, the first thing was to see the assessment of situation and do some research to see the prevalence, what the diabetes had done in Pakistan. So number one evidence was from National Diabetes Survey of Pakistan, which was done in 2016-17 by Dr. Abdul Basit. It shows the prevalence of 26.3, and in that pre-diabetic were 14.4%. And the risk factors were diabetes, dyslipidemia, gender, age, education, etc. The second evidence was the study of prevalence of type 2 diabetes and pre-diabetics using HbA1c. It was done by Dr. A.H. Amir and his team with a participation of more than 18,000 participants, showing prevalence of 16.98%. And the pre-diabetic were 10.91. On the basis of this, we have come to the conclusion that we have the problem which is on the rise. And if you look at the age factor, gender, female gender, hypertension, family history, education, and BMI are the risk factors for the increase of diabetes in our community. So if the steps taken by the world for prevention, why can't we? So if you look at Pakistan, what we are doing in the health promotion programs in a form of awareness walks, lighting of buildings, religious clerics. Through religious clerics, we reach the community that we are this problem is going to playing havoc in your lives, and it is on rise. Secondly, the health diet promotions. It is through books, through online posters, and through different apps to advise our people for healthy diet, and their diet behavior should change. Physical activity encouragements. This run for life, healthy life activity was done, and it was in schools, awareness programs through physical activity, cycles. These are the different activities we do. For taxation, we touch with the help of our different societies, we touch the National Assembly to increase the taxation on sugary drinks, but still we are struggling in it. The screening programs at different levels in all over Pakistan had been done. The accessibility to care through this mobile unit of KP government, it was the initiative in 2019 that the mobile health unit were formed. Through REACH clinics, Pakistan Endocrine Society reached through these early accessibility to the doors of the patient, that they should come and check their sugar levels. Different school programs, collaborations between the government, between Balochistan government and Pakistan Endocrine Society, between the KP government and Pakistan Endocrine Society, they are for prevention of diabetes. Then community-based learning in a form of that no sugar vending machine in Saudi Arabia had been done, and it is the same in KP. We have advised that there should be no soft drink, and it is also in Punjab also. So what we are lacking, these are the things, if you compare the world with Pakistan, we are doing the same things, but we are lacking. Economic factor is the main thing that we get stopped. After starting the project, it doesn't sustain. The coherence among ourselves and among with the government, and limited infrastructure. We struggle in infrastructure. Good workforce is not there. We have to depend some private organizations to help us. And at last, sustainability of projects. We start a good project, and after some days or weeks, due to finances, to the limited infrastructure, we stopped it. These are different reports published in different segments of world for diabetes and its prevention. Global report on diabetes in 2016, IDF guidelines for type 2 2017, CDC's program of prevention of type 2 diabetes in 2019, ADA diabetes prevention in high-risk individuals, NIH in type 2 prevention study, ESD clinical practice guidelines, NIH disease prevention program. These are the different studies. In Pakistan, National Diabetes Survey was published. Lancet Global Burden of Disease and Chronic Disease Prevention. These were different reports which were published in different segments of world. So what Pakistan Endocrine Society, with the help, as Pakistan Endocrine Society is the largest body to present the endocrinologist and diabetologist in Pakistan. So we think, and we start this program, diabetes prevention program, in 2019 in Karachi, with Professor Khurshid, Abdul Basit, Dr. A.H. Amir, and Dr. Arshid were there. On basis of some intervention studies, small scale were done, which shows that their risk reduction with intervention with reduce for diabetes from 71 to 76% if they are intervened. Then we formed the steering committee, and it started working in 2021, and we then published our Pakistan Diabetes Prevention Program, which shows that how we will tackle this disease or this endemic. So we have developed different teams: developmental team, media team, IT, advocacy, and research. And we have different coordinators in 4 provinces, which are our vice presidents. And we touch university of colleges, health settings, and local area team. This was the framework on this we start program. And we started to see that how, as I said, that before starting a program, we should assess. So we start one of our pilot project for intervention to prevent diabetes. And then today we are going to launch our social media campaign for prevention of diabetes. Under this program, we've done different programs, and we have signed an MOU for prevention of diabetes with KP government and Pakistani Endocrine Society. This research project, which we started, which has a pilot, which was a prime objective, was to launch a nationwide primary prevention program to reduce the risk of type 2 diabetes in Pakistan. It was prospective intervention longitudinal study, which on basis of prevalence of 14.4 for pre-diabetics, and design sample was calculated to be 2,600. And it was based on to distribute that in 5 centers, both rural and urban. The duration of this study was around 3 years, and it is being done, and it is in the we have touched around 33 centers. The inclusion criteria was subjects living in Pakistan with Pakistani national age 20 or above, and all known diabetics or subjects taking oral hypoglycemic, insulin, and pregnant women, and subjects who refused to participate in this study were excluded. The diagnostic criteria are based on fasting plasma glucose, and then we have to perform OGTT and HbA1c. The intervention was that lifestyle and dietary advice by a specified dietitian and diabetic educator will be done for intervention of the study. We have developed a helpline number, and then we give to our patients, and they are being contacted on this number. And diabetic patient, we have a drop registry. We are in touch with that registry, and the patient goes in that registry. The expected outcomes were that what percentage of the pre-diabetic patients changed to type 2 diabetes, remained the same as pre-diabetic, or became normal. These were the expected outcome of patients. The source of funding was Pakistani Endocrine Society, which arranged the funds for this study. This is the till now the data, which shows us 2648 is our sample size. We did 31 camps till now in different areas of Pakistan. 1982 patients were screened, 1109 were included in studies, and of them there were 175 pre-diabetics. And we have one follow-up camp in Sindh urban area, which has been completed. These were different camps. If you look at this, it's a total screen patients, female were 33% and males were 67%. And in total enrolled were male were 81% and female were 19%. And pre-diabetics, males were 84% and 16%. This was, in the morning we were talking with Peter Schwartz that why the males had been more as compared to the female because of the accessibility. Total number of camps, the age-wise analysis, it is around 28% in more than 50 years and 34 plus 38% in a range between 20 to 50 years. And this is the area which is playing havoc in Pakistan, that these pre-diabetic patients will turn in a few months' time if we don't intervene at this, now to these patients. And weight-wise analysis, that females were more than 84% and 16% were male. This is the results on basis of one center, Sindh Urban, which shows fasting blood sugar. Their pre-diabetic range was 30 13.61. And this to our glucose, the pre-diabetic were 20.7. And these were the HB1C results on basis of that. This follow-up shows, if we break up this 13.61 after 6 months follow-up, 59% of them get healthy, 33% remain pre-diabetic, and 8% turn to be diabetic. Due to this intervention of our, this improvement was more than 50%, which was good for us and give encouragement that we should go more in the study and contact the persons. The requirement, the challenges we are facing nowadays in this, that requirement for fasting, people usually come in, they are not well aware of it. Funding, we are lacking behind. Infrastructure development, literacy, and preferences. Preferences mean that my preferences is that we should screen each and everything. But the preferences of the patient is that diabetes is not a problem in their face. So looking this, what was our next step? Next step is to increase the awareness among, as we can't touch each and every person, we started our social media awareness program from this month, and inshallah it will be run by specialized persons, and we hired a team, and we will be touching in each language, in each things all over the Pakistan through social media awareness campaign. So what should we do? We should unite together and move forward. We should continue our hard work, what we are doing, we should keep on doing it, but with unity and sustainability. Keep your things in, there may be some failures regarding it, but you have to move forward. And just to pray from God that there should be some, कहते मदद ऊपर से आ जाए तो बेहतर है. Thank you.